When we talk about early warning signs of serious health conditions, one of the most overlooked signals comes from something as simple as a tingling sensation in your feet. Many people experience what they describe as pins and needles from time to time, often brushing it off as harmless or temporary. Maybe you've been sitting too long, or your foot fell asleep. But when this sensation becomes frequent, persistent, or occurs without an obvious reason, it may be your body trying to tell you something far more important. In the context of overall health, especially when we consider conditions like diabetes mellitus, this seemingly minor symptom can be an early warning sign that should never be ignored. This tingling or numbness is often linked to a condition known as peripheral neuropathy, which is commonly associated with diabetes. Over time, elevated blood sugar levels can damage the tiny nerves in your body, particularly those in your extremities like your feet. These nerves are responsible for sending signals to your brain, signals that allow you to feel touch, temperature, and pain. When they begin to malfunction, those signals become distorted. Instead of normal sensation, you may feel tingling, buzzing, or even a slight electric-like feeling. At first, it may come and go, easy to ignore, but as the underlying issue progresses, it can become more constant and more intense. What makes this especially important is that these sensations often appear before a person even realizes they have diabetes. Many individuals live with undiagnosed diabetes for years, and during that time, silent damage is already taking place within the body. The feet, being farthest from the heart and more vulnerable to circulation issues, are often among the first places where symptoms show up. So when you notice persistent tingling or numbness, it's not just a discomfort, it's a potential early alarm system. Another important aspect to understand is how easily this symptom can be dismissed. People often attribute it to fatigue, poor posture, or even aging. While those factors can sometimes play a role, they don't typically cause ongoing or recurring sensations without a clear trigger. This is why awareness is so critical. Recognizing that your body communicates through subtle signs can make a significant difference in early detection and prevention. In addition to nerve damage, poor blood circulation also contributes to these sensations. High blood sugar can affect blood vessels, reducing the flow of oxygen and nutrients to the nerves. This combination of nerve damage and reduced circulation creates a cycle that worsens over time if left unaddressed. The longer it continues, the greater the risk of more serious complications, including complete loss of sensation, which can lead to unnoticed injuries and infections. It's also worth noting that this symptom doesn't always come with pain. In fact, some people experience numbness without any discomfort at all, which can be even more dangerous. Pain often prompts us to take action, but numbness can quietly progress without drawing much attention. This is why regular self-checks and being mindful of even the smallest changes in your body are so important. From a broader health perspective, this point highlights a powerful message. Small symptoms can carry big meaning. Your body rarely jumps straight to severe warning signs. Instead, it starts with subtle cues, gentle nudges that something isn't quite right. Listening to those cues, especially when they persist, can be the difference between early intervention and advanced complications. So if you or someone you know experiences frequent tingling or numbness in the feet, don't ignore it, don't normalize it, and don't delay seeking medical advice, because early attention can prevent serious consequences later. Another critical warning sign that often goes unnoticed is the presence of cuts, blisters, or sores on the feet that take an unusually long time to heal. At first glance, this might not seem alarming. After all, minor injuries happen all the time, whether it's from a new pair of shoes, a small scrape, or stepping on something sharp. Normally, the body has an incredible ability to repair itself. But when healing becomes slow or incomplete, it can be a sign that something deeper is affecting your overall health, particularly when we consider conditions like diabetes mellitus. In a healthy body, the healing process is efficient and well coordinated. Blood flows to the injured area, bringing oxygen, nutrients, and immune cells that fight infection and rebuild damaged tissue. However, when blood sugar levels remain consistently high, this process becomes disrupted. Diabetes can damage blood vessels, reducing circulation, especially to areas like the feet. With less blood reaching the wound, the body struggles to deliver what it needs for proper healing. As a result, even small cuts can linger for weeks instead of days. This issue is often made worse by a condition known as peripheral artery disease, which is more common in individuals with diabetes. In this condition, narrowed blood vessels further limit blood flow to the extremities. The feet, already at a disadvantage due to their distance from the heart, become even more vulnerable. When circulation is poor, not only does healing slow down, but the risk of infection also increases significantly. Another layer of concern comes from nerve damage or diabetic neuropathy. When sensation in the feet is reduced, a person may not even notice that an injury has occurred. A blister from tight shoes or a small cut from stepping barefoot might go completely unnoticed. Without awareness, the injury is left untreated, giving it time to worsen. What starts as something minor can develop into a more serious wound, sometimes leading to ulcers. Foot ulcers are one of the most serious complications associated with diabetes. These open sores can become infected and, if not properly managed, may lead to severe consequences. The combination of poor circulation, slow healing, and reduced sensation creates a dangerous situation where the body is less capable of protecting and repairing itself. In extreme cases, untreated infections can spread, increasing the risk of more drastic medical interventions. What's important to understand here is that the delay in healing is not random, it is a signal. It reflects how well your body is functioning internally. When healing slows down, it's often because the systems responsible for repair are under stress or not working as they should. This is why paying attention to how your body responds to injuries is so important. It provides valuable insight into your overall health. Many people tend to overlook this sign because it doesn't cause immediate discomfort. A small cut that isn't healing might not seem urgent, especially if it isn't painful, but this is exactly why it can be so dangerous. The absence of pain does not mean the absence of a problem. In fact, in the context of diabetes, it often means the opposite. From a broader perspective, this warning sign reminds us of the importance of daily awareness and care. Simple habits like checking your feet regularly, keeping them clean, and addressing even minor injuries promptly can make a significant difference. It's not about becoming overly worried, it's about being informed and proactive. So if you notice that cuts or sores on your feet are taking longer than usual to heal, treat it as a serious signal from your body and seek medical attention early because timely care can prevent complications and protect your long-term health. Another warning sign that deserves serious attention is the presence of burning pain or sharp stabbing sensations in the feet, especially when there is no clear cause. This type of discomfort can feel confusing and even frustrating. Some people describe it as a deep burning feeling, while others experience sudden jolts of pain that seem to come out of nowhere. It may start off mild and occasional, but over time it can become more frequent, more intense, and harder to ignore. When we look at overall health, particularly in relation to diabetes mellitus, this kind of pain can be a significant early warning sign that the body is under stress. This sensation is most commonly linked to nerve damage, specifically a condition known as diabetic neuropathy. As blood sugar levels remain elevated over time, they begin to affect the delicate network of nerves throughout the body. The nerves in the feet are especially vulnerable because they are the longest and farthest from the central nervous system. When these nerves become damaged, the signals they send to the brain can become distorted. Instead of transmitting normal sensations, they may send pain signals even when there is no injury present. What makes this type of pain particularly challenging is that it often intensifies at night. Many people report that the burning or sharp sensations become more noticeable when they are trying to rest. This can interfere with sleep, leading to fatigue and affecting overall well-being. The lack of rest can then create a cycle where the body becomes more stressed, potentially worsening other health conditions. So this is not just about discomfort in the feet, it can impact daily life, mood, and overall quality of life. Another important aspect to understand is that this pain can occur even in the absence of visible symptoms. Unlike a cut or swelling that you can see, nerve pain is internal. The feet may look completely normal on the outside, which can make it harder for individuals to recognize that something is wrong. This invisibility often leads people to dismiss the sensation or delay seeking help, assuming it will go away on its own. But when the underlying cause is related to nerve damage, the condition typically does not improve without proper management. In some cases, people might try to cope with this pain by changing their routines, avoiding walking too much, wearing different shoes, or using home remedies. While these adjustments might provide temporary relief, they do not address the root cause. The real issue lies within how the body is processing and managing blood sugar, and how that is affecting the nervous system over time. Ignoring the source allows the damage to progress, which can eventually lead to more severe complications, including increased sensitivity or, paradoxically, complete loss of sensation. It's also important to recognize that pain is the body's way of demanding attention. Unlike numbness, which can quietly develop, burning or sharp pain is more direct. It's a signal that something is actively wrong and needs to be addressed. In the context of diabetes, this pain is not just a symptom, it is evidence that the nerves are already being affected. Catching this early can make a significant difference in slowing progression and managing the condition effectively. From a broader health perspective, this warning sign reinforces the importance of listening to your body, even when the symptoms seem unusual or hard to explain. Pain without a clear cause is never something to ignore. It is often one of the clearest indicators that internal systems are not functioning as they should. So if you experience persistent burning or sharp pain in your feet, especially without an obvious reason, take it seriously and seek medical guidance, because early intervention can help protect your nerves and preserve your long-term health. Another important warning sign to pay close attention to is any noticeable change in the color or temperature of your feet. These changes might seem subtle at first, a slight redness, a pale or bluish tone, or perhaps one foot feeling warmer or colder than the other. Many people overlook these differences, assuming they are temporary or related to the environment. But when we look at overall health, especially in connection with diabetes mellitus, these physical changes can be early indicators of underlying circulation problems. In a healthy body, blood flows smoothly through the vessels, delivering oxygen and nutrients to every part, including the feet. This steady circulation helps maintain a normal skin tone and a balanced temperature. However, when blood sugar levels remain high over time, they can begin to damage blood vessels. This damage affects how efficiently blood can travel, particularly to the extremities. As a result, the feet may not receive the proper supply they need, leading to visible and noticeable changes. For example, feet that appear unusually pale or even slightly bluish may be signaling reduced blood flow. On the other hand, redness could indicate inflammation or pressure in certain areas. These color shifts are not random. They reflect how well your circulatory system is functioning. A condition like peripheral artery disease, which is more common in people with diabetes, can further restrict blood flow, making these symptoms more pronounced. Temperature changes are another key signal. If your feet often feel significantly colder than the rest of your body, it may suggest that warm blood is not reaching them efficiently. In contrast, unusual warmth in certain areas could be a sign of inflammation or even the early stages of infection. What makes this particularly important is that these temperature differences may occur without pain, making them easy to ignore. At the same time, nerve damage, such as diabetic neuropathy, can interfere with how you perceive these changes. Some individuals may not fully feel temperature differences, while others might notice them more intensely. This inconsistency can make it harder to rely on sensation alone, which is why visual awareness becomes so important. Simply looking at your feet regularly can reveal changes that you might not feel. Another reason this warning sign matters is that it often develops gradually. Unlike sudden injuries, circulation issues build up over time. The body tries to adapt, and symptoms may come and go, making them seem less serious than they actually are. But over time, reduced circulation can lead to more severe complications, including delayed healing, increased risk of infection, and damage to tissues. This is why consistency in noticing these changes is key. A one-time difference in temperature might not be concerning, but patterns matter. If your feet frequently feel colder than usual, or if you consistently notice unusual color changes, it's a signal that should not be ignored. Your body is providing visible clues about what's happening internally. From a broader health perspective, this point highlights how closely connected our body systems are. Circulation, nerve function, and skin health all work together, and when one is affected, the others often follow. Paying attention to these external signs gives you an opportunity to respond before more serious complications develop. So if you notice ongoing changes in the color or temperature of your feet, don't dismiss them as minor or temporary, but take them seriously and seek medical advice, because early detection can help prevent more serious circulation-related complications. Another warning sign that is often underestimated is having excessively dry, rough, or cracked skin on the feet. Many people think dry skin is simply a cosmetic issue or the result of weather, dehydration, or lack of moisturizing. While those factors can certainly play a role, persistent dryness, especially when it leads to deep cracks in the heels, can be a sign of something more serious when viewed in the context of overall health and conditions like diabetes mellitus. In a healthy body, the skin naturally maintains a balance of moisture through the production of oils and sweat. This balance helps keep the skin soft, flexible, and able to act as a protective barrier against the external environment. However, when blood sugar levels remain high over time, this balance can be disrupted. Diabetes can affect the nerves that control sweat glands, a condition linked to diabetic neuropathy. When these nerves are damaged, the skin may lose its ability to stay properly hydrated, leading to dryness. This dryness is not just about appearance, it directly affects the strength and integrity of the skin. When the skin becomes too dry, it loses its elasticity and can begin to crack, especially in areas that experience pressure, like the heels. These cracks, sometimes called fissures, can become quite deep and painful. More importantly, they create openings in the skin, which is meant to act as the body's first line of defense against bacteria and infection. At this point, what started as simple dryness can turn into a more serious health concern. The feet are constantly exposed to different surfaces, and even with proper hygiene, bacteria can easily enter through these small openings. For individuals with diabetes, this risk is even greater because the body's ability to fight infection may be compromised. In addition, reduced blood circulation can make it harder for the body to deliver immune cells to the affected area, slowing down the healing process. Another factor to consider is that dryness can sometimes go hand in hand with reduced sensation. When nerve damage is present, a person may not feel the discomfort or pain that typically accompanies cracked skin. This means the condition can worsen over time without immediate awareness. A small crack can deepen, and what could have been treated early may develop into a more serious wound. It's also important to understand that this type of dryness is often persistent. Unlike temporary dry skin that improves with simple care, this condition may not fully resolve without addressing the underlying cause. Moisturizers may provide relief, but if the root issue is related to blood sugar levels and nerve function, the dryness will continue to return. From a broader health perspective, this warning sign reminds us that the skin reflects what is happening inside the body. Changes in texture, hydration, and appearance are not random, they are signals. The body is communicating that something is out of balance, and it requires attention. Simple daily habits, such as checking your feet, keeping them clean, and moisturizing regularly, can help manage this issue. But awareness is the first and most important step. Recognizing that persistent dryness is not always harmless can lead to earlier detection of more serious conditions. So if you notice that your feet are consistently dry, rough, or developing cracks, don't ignore it or treat it as just a minor inconvenience, but take it seriously and seek proper care, because protecting your skin is an essential part of protecting your overall health. The final warning sign, and perhaps one of the most dangerous, is a loss of sensation in the feet, when you can no longer properly feel touch, heat, cold, or even pain. At first, this might seem like a relief, especially if you've experienced discomfort or pain before. But in reality, this loss of feeling is not a sign of improvement. It is a serious indication that nerve function has been significantly affected. In the context of overall health and conditions like diabetes mellitus, this symptom represents a more advanced stage of damage that should never be ignored. This condition is most commonly caused by diabetic neuropathy, where prolonged high blood sugar levels damage the nerves responsible for sensation. Over time, these nerves lose their ability to transmit signals effectively. What begins as mild tingling or occasional numbness can gradually progress into a complete loss of feeling. The feet may feel dead, heavy, or disconnected, as if they are no longer fully part of the body. What makes this especially dangerous is that sensation plays a critical role in protecting us from harm. Pain, for example, is a natural W.